before bipolar was made, monopolar was made first. However, for the history, let's start with the history of the bipolar electrosurgery. So let's see, back in 1955, Leonard Malus first developed, I guess you can say, the beginning of the bipolar. So blood coagulator was based upon a spark gap technology. As you can see in the picture, that two electrodes. These two electrodes are one positive and negative. In the gap, it's just air. So when you shoot some sort of electrode through it, it makes sparks. And that spark would, I guess you can say, inspired most scientists or researchers to develop the bipolar technology. So yeah, bipolar electrosurgery. Again, once they found out that you can actually use electrode in some way to make monopolar better by controlling the voltage that's coming out of it, controlling the current, so it doesn't really affect the other tissues inside the body. So in 1983, that's when they first made the bipolar electrosurgery, but this was used mostly in dentistry for now. So with bipolar technology, that one of the main purpose of this technology was to minimize the disadvantages or problems that occurred in monopolar electrosurgery. As you can see on this table, that monopolar has several disadvantages compared to the bipolar, just because bipolar is created to fix this problem. One of the most, or the couple most important problem was the traumatic, when people had, like, broken arms, broken foot, or something, you have to put a bolt into one of your bones to make it straight or place it there. Monopolar can't really affect or can't touch the metal part, or the spark will form, and that spark will cause burn throughout the patient's body. And then this next image, this video, you can see that so what this video is supposed to show you was that around the monopolar electrosurgery knife, that around it it's an insulator. However, for monopolar, to actually use it, you have to increase the voltage. When you increase the voltage, it's going to melt the insulator outside of it, but it's going to attach itself to the tissue, and that's what we do not want. For bipolar, it actually reduces the current flowing through the knife, so it reduces the heat, reduces the voltage. It uses the tissue as a connector, as a bridge. That's why to help it reduce that voltage. And then, as you can see how it works, it's just, a knife has two parts. I guess you can say it's like a tong or something like that. One is a positive end, the other is a negative end. So the electrode will go through the positive, and then it uses the tissue that it's grasping, and actually makes that into a bridge. So the current will flow from one end through the tissue and up the other end. So the cutting action of the bipolar knife is just, it uses wavelength. In our case, it's sine wave. With higher voltage, increased wavelength, that's going to increase the probability of creating some sort of thermal damage or sparking. And the most important point is the current spread. With current spreads, you have random burning throughout the body, like we've seen with microslides. And then one of the problematics is desiccation. Desiccation is one of the it's just the drying of the tissue. So the electro knife or the electrosurgery dries the tissue, and then when voltage hits it, it should be able to cut it. But with the problem that's happening right now is when the bipolar, the monopolar knife tries to cut it, it's going to cause major burning sensation in that area, and to control it, that's why they use that technique where the electrodes are going into a circuit or a current circle from one end to another through the tissue to reduce that.
So these are some of the the advantages of using an electron knife for electrosurgery is you actually lose a lot less blood. If you use a regular scalpel, you lose about 31 milliliters of blood during the incision time. Whereas if you use the electron knife, you only lose about 13. This is due to the fact that as you are cutting the skin with the electron knife, you're also cauterizing the wound. So that pretty much seals it off, so you prevent a lot of blood flow. As you can see from the chart as well, the SB is the subjective pain. That's like I said, it's the name itself explains it. It's subjective, so it's not really a good way to say that, well, the electron knife is better because it causes less pain, because it is subjective depending on the patient. The only way to truly see if the electron knife is better for the pain is to test it, is to be able to have one patient undergo 2 surgeries, one with a scalpel and one with a knife, have any surgeries. And you also have a faster discharge rate from the hospital because, as you can see from the picture above, when you use a scalpel for a surgery, you end up having to cut a very large incision inside the person, so it exposes a lot of the internal organs, which can actually lead to possibly lead to more infection because it is so open. Whereas if you use the electron knife, it's essentially a laparoscopic surgery where you insert carbon dioxide gas inside of the patient, inflating their abdomen, and you cut small holes inside of the strategic positions around the abdomen, so that you can insert the instruments that you need throughout the surgery. So that's really most of the major advantages due to the electrosurgery is that it's just you reduce the risk of infection just because you're not exposing your internal organs, and you can pretty much go home almost the same day, depending on your stability after the surgery. These are the disadvantages of it though. Since it is laparoscopic, you don't have as much motion that you would have when you're using regular surgical tools. Since you're not actually using your hands, you're relying more on your skills of using the instruments through the abdomen. So it's like essentially kind of like playing if those joystick games where you're trying to pick something up, like a stuffed animal out of a machine. It's kind of the same way. You kind of have to eyeball it and hope you get it in the right position. So it does require a lot of skill to be able to do this. Otherwise, you could potentially cut the wrong organ, or cut or burn the victim, or burn the patient. You can see here down at the bottom, the encircled area is a small burn that was caused onto the patient. You see the long black rod is the actual electron knife, and the thing that's being pulled from it is an accidental burn. On the end of it, to the far left, you can see a little white spot. That's the actual electricity being discharged from the knife, used while it's cutting the actual thing. Again, it's just all due to you have a limited motion while you're using these instruments, because you're working on the outside, and it's a reverse action. So you need to be really, really skilled with that. And you also lose a lot of depth perception, because it's just you're looking at it at what you're doing through the camera. So you're essentially, again, just eyeballing the entire surgery and hoping you get it right. So it does take a lot of practice, and it requires a lot of skill to be able to do these surgeries correctly. Otherwise, you can really, really harm the person that's having the surgery done on.
Okay, so another tool that's being used in electrosurgery is called the Da Vinci surgical system. It's created by Intuitive Surgical. Here's a quick overview of the system itself. So the Da Vinci system was created because there were some limitations of the laparoscopic methods. Here's the machine itself. There are 3 parts of the machine. The first part is the surgeon console, as you can see in this image. The second is the bedside robotic arm. And lastly, the HD vision sensor. All these 3 work together. As you can see, the Da Vinci system is very mobile. You can push it with one person and it moves right next to the patient. It comes with a user-friendly design for instrument exchange. As you can see, this nurse is switching out different instruments of pliers, scalpels, electron knives, or anything that is necessary for that procedure. This is the surgeon console again. The console allows for a high-definition 3D view of the surgical field. In this example, it shows that the device can scale the movement of what the surgeon is doing. It can filter out the tremors and shakes of the surgeon, as well as translate each movement to the robotic arms that you see in the above demo. Again, this is just a demo. It's not a real depiction of what he's doing. He's just stitching back together some fibers, or just some cloth, just to show. As you can see, the surgeon is very accurate with every motion. He's not dropping the needle or anything. This is the endo-wrist technology that it uses. It allows maneuvers that would be impossible in laparoscopic surgery because it has 7 degrees of freedom and can bend where a normal human wrist would not be able to. So some advantages and disadvantages of using the Da Vinci system. First, it's very mobile, it's user-friendly, it's less invasive, it's very precise, has the endo-wrist technology, has reusable parts which cut down on cost, and has the high-definition 3D view. And some disadvantages is that it's a very expensive system. As you can tell, that thing does not look cheap, and that is a new technology that not many surgeons out there know how to use it. So, the Da Vinci, it benefits the hospital, the surgeon, the ORT, and most importantly, the patient. This helps everybody in the surgical room because it makes the surgery less invasive, cheaper, and just more precise throughout the entire process. So, in conclusion, electrosurgery devices are the new frontier of the medical technology. Electrosurgical devices are safer, they limit blood loss, they're in high precision, and helps patients and surgeons together. As young, ambitious bioengineers, we should be familiar with the technology within the operating room, because one day we could be working with the technology, whether developing the technology or working beside the technology. And here are references. Any questions?
Questions for them? Hold on, let me make sure I get who's
With the
asking.
Da Vinci surgical system.
I can't really hear you.
So, saying with the Da Vinci surgical system, if the surgeon was like moving, say like arms and like stitching something, would it be able to sense like force, like resistance against like tissues? So like, would it be able to feel if like he's poking against something hard or soft?
I'm not exactly sure, but I mean, in the image, it seemed like he knew. It felt like he had a good feeling of where everything was. So I don't know if there's resistance built into it. So, I don't believe so because there weren't any sensors on the end of the endo-wrist. You need some type of feedback on that end. But the surgical camera, the surgical field that he has is you can change it as well. So there are you can maneuver the camera to where you want to see if necessary.
Well, it really depends on what you're using. So, like I said, there's also the cutting current and there's the pulverization. So for the cutting current, that would need a lot more voltage. So that can go as high as 1,000 volts. But for like pulverization, that only goes as 200. So that would be it would depend on which one you want to use.
Any other questions?
The bipolar electrosurgery, can you only use a sine wave or can you use any other type of waves?
It's slow continuous sine wave is most preferred. It's the fact that with low continuous sine wave, they will control the heat. They will control heat, control voltage, current. So when you try to do something, you're not going to overpower cut one tissue. If you do that, it tends to have it's going to backfire by making small burns or bigger incisions where the current will actually flow through the entire body and create tiny burn marks on the body. So it's right away it's a low continuous sine wave is most preferred.
There's no other questions, and let's move on to the next